Joining me now from London is Dr. Anthony Costello, Professor of Global Health and Sustainable Development at University College London. Thanks for being with us. What do you make of what the Prime Minister is saying, that we can learn to live with COVID without letting our guard down? Do you agree with that approach?
Well, certainly we're in a different position now with Omicron. This, we only knew about this 6 weeks ago, and it's exploded. It's doubling every 2 days. It's 3 times more transmissible than Delta. You're 5 times more likely to be reinfected. And it's now the dominant. I mean, more than 90% of cases in the UK are now caused by this new variant. So it's a different situation now, because it is going to be far more difficult to suppress it in the way that in the first year of the pandemic, we very much supported a full suppression, if you like, a zero COVID policy, which worked very well in the East Asian states because they've had much, much lower death rates. But with this variant, it's extremely difficult to suppress. Having said that, I don't fully agree with the British government. I mean, we had so-called Freedom Day back in June last year, or July last year, and since then, we have been much more lax in introducing any real restrictions and in, implementing masks and things like that on public transport compared to our European neighbours. What we have to do at the moment is to communicate much better with the public. I mean, still, many people don't know about the risks of COVID. Many of them don't really understand the symptoms of Omicron because they're different from Delta. Fortunately, it's more of an upper respiratory tract infection than lower. About social contacts, of course, protecting people with high quality masks, lateral flow tests and the like.
Yeah, and the other thing as a journalist that I'm not seeing necessarily communicated very clearly is that the hospital wait lists for non-COVID treatment and procedures is so long that even if you don't catch COVID, if you get in a car accident, if your parents, have a heart attack or a stroke or a loved one has a medical emergency, they might have to wait a very long time before they get treatment. Worst case scenario, they could die if they have to wait too long for an ambulance. Are you sometimes frustrated that the messaging on that level doesn't seem to be cutting through?
Yes, I think you're absolutely right. The National Health Service, although we're seeing, lower levels of hospitalization, although they're up at first wave levels, but they're not at second wave levels. But we've got massive backlogs, as you say. We've got staff shortages. The staff are tired. The staff are off sick, and now an awful lot of them are isolating. So it's well over double the number of absences of last year. And for all those reasons, I mean, having a few soldiers come in is going to help with some of the behind the scenes action. But at the end of the day, we should be able to mobilize enough doctors and nurses to manage this particular wave of the infection and get through it. But you're right, the damage to the longer term functionality of the health service is a big worry. And we've got to think, because, a lot of people are thinking that this Omicron is the end. But, it doesn't create herd immunity. We hope it's going to get milder. But,
why doesn't it create herd immunity if 1 in 10 or 1 in 8 people are infected?
At the moment, because, the assumption is that if you get to a certain level, say 70, 80%, that suddenly you don't have a circulating virus. Well, that's not the case with Omicron, and we know that it's escaping vaccines. We're going to need new vaccines, and we're going to need different kinds of vaccines that have longer lasting impact and also attack this variant in different ways, not just the spike protein. That's going to take time. But, is it going to solve the problem itself and mutate down to a common cold? It might do, but this is a different virus from a cold. And the other coronaviruses we've been living with for hundreds of years. And it may have taken much longer than we think to get down. So we may face similar waves. We may have to get used to the fact that during surges, we're going to have masks, ventilation, occasionally social distancing, but we've got to keep the economy going. And in that respect, I agree with the Prime Minister.
A quick last one here. if you were advising the prime minister, what approach do you think the government should be taking in order to try to minimize the damage that Omicron is doing?
Well, at the moment, I mean, we advised the government before Christmas to introduce a range of what were called step 2 restrictions, and they
Yeah.
didn't do that. So we're now going to have to face the surge that we're seeing now, and hopefully that will die down in the next 4 to 6 weeks. But one thing that the government could be doing is to support the idea of a vaccine waiver. You know, only less than 4% of people in low-income countries are being vaccinated, and that means millions will die. But it means that all of us are threatened by new variants continually coming. We live in a global world. And at the moment, a few companies are making billions of dollars protected by patents. Now,
Yeah.
actually, President Biden and the Pope and China and Russia have all said we need to expand the production of this, but there's been no agreement. And actually, the UK,
Yeah.
Germany, Japan, and Canada have blocked that. So I think that's something that we need to be tackling as well as the problems at home.
Absolutely. Thank you very much, Dr. Anthony Costello.